So in this video we are going to see about sebaceous glands. So before going into sebaceous gland proper, a few words about exocrine glands. So there are three types. One is merocrine, another one is apocrine, and the third one is holocrine. So what is the difference between these three is that in merocrine glands, the secretory product is released from the cell without any damage causing to the cell. In apocrine glands, along with the secretory product, a portion of the cell gets pinched off and it is released with the secretory product. Whereas in holocrine glands, the entire cell disintegrates and it is released with the secretory product, and as and when the cell disintegrates, new cells they keep forming. So for example, merocrine glands we have sweat glands and sebaceous glands. For apocrine glands we have mammary glands, and for holocrine glands we have sebaceous glands. Moving into the topic proper, sebaceous glands, they are an epidermal appendage associated with upper portion of hair follicle in human skin. So at birth the sebaceous gland they are well developed and then they greatly involute in size, and then again puberty they begin to redevelop, which shows an early sign of puberty. So as with any other gland, the sebaceous gland also contains one lobule or several lobules which open into a common excretory duct. As mentioned already, they are holocrine glands and are always associated with a hair follicle. Of course, there are areas where the sebaceous gland is not associated with an hair follicle, and these areas include meibomian glands at the dorsal plate of eyelid, Forty spots on the buccal mucosa and vermilion border of lips, Tyson's glands on the coronal sulcus of penis, labia minora and inner aspect of prepuce, and the Montgomery tubercles in the breast areola. So this sebaceous lobule, it contains two areas, one is peripheral and another one is central. This peripheral area, it contains no lipid droplets and it is deeply basophilic, whereas this central area contains lipid droplets. And also the sebaceous lobule that is closest to the duct only disintegrates. So next, the composition of lipids, it contains triglycerides and also small amount of phospholipids, cholesterol and waxes, which can be seen by histopathological examination. In electron microscopy, active lipid synthesis and storage can be seen. So in holocrine secretion, as we mentioned already, the entire cell disintegrates and is released as a secreting product, and this disintegration happens by autolysis of cells, for which lysosomal enzymes are needed, including aryl sulfatase and acid phosphatase. So since the sebaceous gland closest to the cell only disintegrates, there will be more activity in the preductal region. So average transit time from formation to discharge of cells is around 7 to 25 days. So regional variation, it can be present everywhere except the palms and soles, and most numerous over the face, scalp, trunk, external auditory meatus and anogenital surfaces. In other areas, the glands are fewer. And applied aspects, as we know, it plays a main role in acne vulgaris. Some differences between sebaceous glands and sweat glands. So as we know, they secrete an oily substance called sebum. These secrete a viscous and odorous substance called sweat. So they are present all over the body except palms and soles, whereas sweat glands, they are more numerous on the ear, armpit, eyes, external genitalia and areola. The sebaceous glands mainly help in lubrication and contain fatty acids, whereas the sweat glands, they play an important role in thermoregulation, and also they contain sodium chloride, water, amino acids, glucose and lactic acid. And also they support the growth of pterosporum ovule and so plays an important role in seborrheic dermatitis, and also it contains the common salt, the Demodex folliculorum mite, and also the lipids are both bacteriostatic and fungistatic. Here now few points about sebum. So the skin surface lipid, they are mainly from two sources. One is sebaceous gland, another one is the keratinizing epidermis. So here is the composition of the skin surface lipids. They contain mono, di and triacylglycerol, which is the triglycerides, and then fatty acids, both saturated and unsaturated fatty acids, of which unsaturated fatty acids they will be more than 50%, and then wax esters, and then squalene, and then sterols and sterol esters, and then phospholipids. So in sebaceous rich areas like face, all the skin surface lipids are of sebaceous gland origin. In fresh sebum, the free fatty acids will not be present. So if you see, both the sebaceous gland and keratinizing epidermis, they contain skin surface lipids. So how do they differ? The sebaceous gland, they naturally do not contain free fatty acids, whereas this keratinizing epidermis, they contain free fatty acids naturally. Then how do the free fatty acids in sebaceous gland come from? So in conditions like acne, due to the action of this bacterial lipase, there will be intrafollicular lipolysis which leads to the formation of free fatty acids. And these free fatty acids, they play an important role in the inflammation evoking property of acne. So next, control of sebaceous gland secretion. So if you see, the glands are small in early childhood and they slowly involute in size. By 6 months of age, the glands are very less in number, and again by 7 to 8 years, they redevelop, which show an early sign of puberty, and they reach a peak in mid to late adolescence. So the development and stimulation is mainly dependent on hormonal factors, particularly androgyny. So it is also found that this thyroid gland can influence sebaceous gland secretion. And for example, in hypothyroidism, there is a decreased amount of sebaceous gland activity. And another thing, the sebaceous gland is not innervated, hence any amount of denervation will not cause any change in the sebaceous gland activity. So next, here are some of the functions of sebum. And the main function, number one, it is plays an important role in barrier protection. By barrier protection, it helps in the regulation of transepidermal water loss and percutaneous absorption. Number two, it emulsifies with eccrine sweat. 3 is antifungal by its fungistatic action, and also it is bacteriostatic, we know, hence it is antibacterial, and then it is found to act as a mosquito repellency also. Number 6, it helps against sunburn and acts as a vitamin D precursor. So sebum alterations in certain diseases. So the sebaceous gland activity, it can increase or decrease in certain diseases. For example, in acne, we know there is an increase in sebaceous gland activity. So here there will be inflammation and there will be formation of comedones. So these comedones, they are mainly found to form because of deficiency of intrafollicular linoleic acid and action of follicular peroxidation of squalene. So what these two is cause, they cause faulty follicular keratinization, which leads to the formation of comedones, and also it helps in the growth of intrafollicular anaerobic bacteria. And then in conditions like seborrheic dermatitis, which we saw already, there will be no increase in the amount of secretion, but it supports the growth of pityrosporum ovale, hence plays an important role in seborrheic dermatitis. Next, in conditions like atopic dermatitis, contact dermatitis, ichthyosis, psoriasis, alopecia areata, etc., the sebaceous gland activity is decreased. You can say the sebaceous gland activity gets decreased in conditions with dry skin, like atopic dermatitis or ichthyosis. Next, the sebaceous gland secretion in systemic disorders. So how systemic disorders affect their secretion? First, we take hormonal disorders. As we know, they are mainly dependent on hormonal factors. So this, if you see the sebaceous gland activity, it varies from person to person. So in conditions with increase in sebum is mainly caused by conditions with androgen excess like adrenal hyperplasia, PCOD, ovarian tumors, and that condition that cause decrease in sebum are mainly due to adrenal insufficiency or hypogonadism. So in these conditions, only the sebaceous gland activity will change. There will be no change in the composition of sebum. In Parkinson's disease, the sebaceous gland activity was found to be high and is attributed to an increase in melanocyte stimulating hormone. And also in Parkinson's disease, due to immobilization of the patient, there will be accumulation of sebum in the pilosebaceous follicles. Next, in conditions like starvation, there will be decrease in triglycerides, and hence there will be a decrease in sebum secretion, which will be reversible on realimentation. So the starvation is one condition where there is inhibition of selective synthesis of skin surface lipids, that is only decrease in triglycerides is seen and there will be no change in squalene. So suppression of sebum, it is mainly a pharmacological suppression is used in acne vulgaris. So two methods can be used. One is, since it is androgen dependent, you can use an androgen antagonist, and another one, you can directly inhibit the lipid synthesis of sebaceous gland. So an androgen antagonist, it is mostly used in women because it can cause feminizing effects in men. So here also you can use two types of methods. One, direct androgen antagonist. Number two, you can decrease the peripheral conversion of androgens. And for direct androgen antagonist, what you can use is this oral contraceptive pills, and then prednisone 5 to 10 mg per day, or dexa 0.25 to 0.5 mg per day. So this prednisone or dexa, along with the anti-androgen effects, they are also supposed to have anti-inflammatory effects, and they have good action as an androgen antagonist. So next is ketoconazole. It inhibits the androgen biosynthesis. And so next is the next three is the drugs that can cause decrease in peripheral conversion of androgens, which include cyproterone acetate with ethinyl estradiol, and then high dose spironolactone, either 100 or 200 mg with ethinyl estradiol, and then cimetidine. So the drugs that decrease the sebaceous lipid synthesis are isotretinoin. So this isotretinoin, the mechanism of action is, so whenever the drug comes in contact with the skin, the cells that are responsible for production of sebum, they stop differentiation. So as they stop differentiation, obviously the amount of sebum produced will get decreased. And since the amount of sebum produced is decreased, the intrafollicular bacteria which are dependent on this sebum for survival obviously get decreased. Hence, isotretinoin is also mainly used in treatment resistant acne. Another important advantage is this isotretinoin, even after discontinuation, this intrafollicular bacteria, they increase in number only very slowly. Hence, it helps in prolonged remission after discontinuation.